Hello and welcome to NCTV episode 119, which is all about jaw issues and how you can help them. So jaws, not the shark. We use them every day, but rarely think about them until they start hurting. But before we move on, there is a more fancy technical term for the jaw, which is the temporomandibular joint, or TMJ for short, just so that you know in case you hear people referring to it. The jaw itself is basically a small but mighty hinge joint that lets you chew, talk, yawn and pull dramatic shocked faces. But when it goes wrong, you'll know about it. So what kind of things can go wrong? One of the most common conditions is simply called TMJ disorder, which is a bit of a catch-all term for pain, clicking, popping or locking of the jaw. Then there's bruxism, which is a fancy way of saying teeth grinding or clenching. It often occurs at night or when you're stressed. Constant grinding can leave you with sore muscles in the jaw, as well as the neck and shoulders, and facial tension, headaches, earache, and even chipped teeth. You might also hear about disc displacement, where the little cushion inside the joint slips out of place, causing the telltale click or even jaw locking. Other possibilities include myofascial pain syndrome, which is basically tight, overworked jaw muscles, and in longer term cases, osteoarthritis of the TMJ, where wear and tear stiffens the joint. What causes all of this? Stress is a big one. Many people clench even without realising. Poor posture, especially the tech neck, where you get this from looking down at screens, and that can add tension to the jaw. Old dental work, injuries such as a knock or whiplash, or even habits like chewing gum constantly can play its part. I've mentioned a few of these already, but some of the signs to look out for include pain and tenderness around the jaw, difficulty opening wide or clicking and popping sounds, headaches, earache and even dizziness. A fun fact for you now, the TMJ is one of the most frequently used joints in the body and it moves thousands of times a day, so it's no wonder it can complain sometimes. And a bit of a not so fun fact for you, TMJ problems can sometimes mimic toothache or ear infections, which is often why it's misdiagnosed. So what can you do about it? The good news is there's plenty you can do in terms of self-help. For example, you can apply heat packs or ice packs for the sore muscles. Try gentle jaw stretches such as opening slightly and moving it from side to side. Try to avoid extreme yawns. Reducing chewy foods like tough meat, giant baguettes or gum. Practice relaxation techniques if stress is one of the triggers. And watch your posture. Keep your head balanced over your shoulders and not leaning forward too far. And also, if you grind your teeth, talk to your dentist about a night guard, which is basically like a gum shield. If pain does persist, be sure to seek the right professional. Start with your dentist to check your bite and teeth. Your GP can rule out other issues too. And of course, an osteopath like me can assess the joints and help with reducing strain on the muscles and joints around your jaw, neck, upper back, by releasing tension, improving movement and posture, and easing those knock-on headaches that can occur, whilst also guiding you with exercises to keep things moving freely. So if your jaw's been clicking like a dodgy door hinge, don't just grin and bear it. A few small changes and the right treatment, and that can stop it from becoming a real pain in the jaw. And that's it for this week's bite-sized bit to help you out flourish. Until next time, keep smiling, but maybe not too wide. See you next time.